If you have a high school student in the family who is thinking about a career in medicine, here is something that could really help. Two oral surgeons whom we know and like are launching a mentorship program that could be absolutely invaluable. They are Doctors Russell Lieblick and Brandon Rehrer of Beacon Oral and Maxillofacial Surgeons. And let's talk to Dr. Lieblick right now. Dr. Lieblick, tell us about the mentorship program.
Well, thanks, John. Thanks for having me. The mentorship program is for late junior high and early high school students who are interested in a career in medicine or dentistry. The idea is that so often we're not engaged with counselors early enough, and we don't understand the process for obtaining the right education and jumping through the right hoops in order to become a doctor of medicine or dentistry. So we wanted to introduce prospective students to the process and to counselors earlier in their education so that they can be more prepared as they move through high school and into college.
Now, the date to circle on the calendar is December 2nd. What's happening on that date?
So December 2nd, we have reserved an area at the area at Eagle Landing, and we'll be presenting sort of our story, sort of what we did. And we have Dr. Aaron Tinkle, who will also be presenting his journey through education and sort of what he does. And then we have two counselors, one from the University of Oregon, and they'll be presenting sort of what it takes to earn the spot that they want in the university that they want, and then what it takes once you get to college and to eventually gain acceptance into medical or dental school.
Well, let me ask you this. If I'm in high school, what should I be doing right now that'll get me to the point where someday people will call me doctor?
Well, that's a good question, and I think every student's journey is a little bit different. I think the number one thing is you have to know from the very beginning that you need good grades. You can't put this decision process off until you're a junior or senior in high school and think that a low GPA is going to get you into the school that you want. The other thing is, and equally important, is colleges look for well-rounded students. They want to see students who are involved in activities, whether it be volunteer work, athletics, anything that can help round out your curriculum vitae and eventually show that you're a serious person who also cares about the community.
Now, what misconceptions do young students, people in high school or younger, have about the medical profession?
Well, I think the misconception is that it's a 9-to-5 kind of thing where you go and see patients at your office, and at the end of the day, it's all done. You know, usually it's a long hours type profession, and people don't really see that because when they go to their physician's office, they might have a 10 to 30-minute appointment at their pediatric practitioner or their dentist, and they don't really see all the work hours that happen that are outside of those patient hours. I think that when you commit to a practice in medicine or dentistry, you commit to a profession that's demanding, and you have to be prepared for that from the beginning.
So the mentorship seminar is coming up on December 2nd, and you have a website where people can find out more.
Our website is Beacon, BEACONOMS.com. There's links there, and you can get all the information. And you can also ask your school counselors. Many of the schools we've already contacted so that they know about it and they can help direct you. And certainly they're welcome to contact our office, and we'll help direct people there too.
All right. That's Dr. Russell Lieblick of Beacon Oral and Maxillofacial Surgeons. Thank you, Dr. Lieblick.
Thank you very much, John.